Hi students, I am Dr. Mohan Bansal. In today's ENT clinic, I will demonstrate you the method of examination of the neck. Before going to the neck examination, you should be little familiar about these certain landmarks which are very important, because in the neck mainly we will see different type of swelling, and when you are describing swelling, particularly its extension, then you are supposed to use some anatomical landmarks. So this is the central line, you can see midline of the neck. In the midline of the neck, the most important structure, that is the chin, and this is the lower border of the mandible, and this is the chin. And here will come the submental space, and here will come the submandibular triangle, and it is the here submental that will come. Then you can see this sternocleidomastoid muscle in the lateral side. So this anterior to this sternocleidomastoid muscle is the anterior triangle, and posterior to this is the entire sternocleidomastoid muscle, and posteriorly you can see the trapezius. This is the anterior border of the trapezius. So the space that lies between the trapezius and the sternocleidomastoid, that will be considered as posterior triangle. So we divide the neck into two triangles, anterior and posterior, and sternocleidomastoid muscle. You can see it has got two heads. Sternal head you can very clearly see, and then the clavicular head. Between these two heads you can feel the space, and this is the site where the internal jugular vein will be there. Then in the midline, the most important, the top that I told you, that is the chin, and then you can feel the hyoid bone. I can feel the hyoid bone, and below the hyoid bone you can see this thyroid cartilage. These are the two L of the thyroid cartilage which are meeting in the center and forming the angle. So this angle is acute in cases of males, so you can see very nicely this Adam's apple. Little below if you come, then I can feel now the cricoid cartilage, and the space that is lies between the cricoid and thyroid is the cricothyroid membrane is there, and just below the cricoid cartilage you can feel little soft tissue structure, and that is the isthmus of the thyroid. And below you can see this space. This is the suprasternal space of Bunn. It's very common site for the common this cold abscess, you can see. And sometimes even if the thyroid is enlarged, this space may be having little fullness, because this space can be covered by this thyroid swelling here. Now this posterior triangle we were talking about, it is divided into further two triangles, the supraclavicular triangle and the occipital triangle. Now these two triangles, they are separated from each other by the inferior belly of the omoid. Inferior belly of the omoid will come here, that will emerge just at the junction of the clavicle and the trapezius, and then this is the clavicle, and this is the lower end of the neck, lower boundary of the neck, and below that the thorax and chest will start. So this entire area you can see, this again you can see, this is the sternocleidomastoid muscle, this is its anterior margin, and this is the posterior margin, and here is the anterior margin of the trapezius. As you know, all these structures, they are attached to the mastoid bone. So you can feel the mastoid bone. So the name is sternocleidomastoid, sternal head, clavicular head, and then the mastoid. So at the mastoid it is inserted there. It arises from this low part. Similarly, the trapezius also, with the upper part you can see that it will go up to the mastoid, and the occipital bone rather. Superior nuchal line is there, it is attached to that. And then we can see the junction of this posterior triangle, and that will be the point where the sternocleidomastoid and the trapezius they meet. Sometimes at that side we can see some occipital lymph nodes. So this was regarding the posterior triangle that is separated, that is further divided into two triangles, supraclavicular and the occipital, and that is separated by the inferior belly of the omoid. Now the inferior belly of the omoid, it will travel further, and then it will get ultimately attached to the hyoid bone. Now regarding the posterior triangle, anterior triangle, it is further subdivided into four triangles. One is the submental triangle. So the submental triangle is bounded by the anterior belly of the digastric, and low down it will come the hyoid bone. Then the submandibular triangle, that is also called digastric triangle, that is formed by the two bellies, anterior belly and the posterior belly of the digastric muscle, and superiorly it is bounded by the inferior border of the or base mandible bone. Then little posterior you can feel the mastoid also. So up to mastoid, if you draw a line, so up to that part, that is included in the neck. Okay, so this was regarding the submental triangle and submandibular triangle. And then the carotid triangle. The carotid triangle is posteriorly bounded by the sternocleidomastoid, and anterior superiorly is bounded by the this posterior belly of the posterior belly of the digastric muscle, and inferiorly by the superior belly of the omoid muscle. So this carotid triangle is very important because at this carotid triangle, the carotid and common carotid artery, it ends by dividing into two branches, main branches, the internal carotid and the external carotid. And then comes the muscular triangle. The muscular triangle you can see is bounded by this again the anterior margin of this sternocleidomastoid, and superior it will be bounded by the superior belly of the omohyoid, and in the center is the midline. So this is the area of the muscular triangle. In the muscular triangle, we can see this lobe of the thyroid gland that will lie there, and all the great vessels also, they are very close there. So this much you know regarding the anatomy of this neck. Then you should know the different levels of the lymph nodes. That I will show you. There are 6-7 levels of the lymph node. So that you should know. Level 1 lymph nodes, they include submental lymph nodes and the submandibular lymph nodes. And submental is also this first level lymph node. They are also divided into two groups, A and B. So first A is of this mental, and first B, 1B of this level, that is submandibular lymph nodes. Then comes the deep cervical lymph nodes. So these deep cervical lymph nodes, they are 3, and they lie beneath this sternocleidomastoid muscle. Okay, beneath it means deeper to this. So the level 2 will lie somewhere here. Okay, from this, its lower limit is the hyoid bone. So at the level, this hyoid bone will be somewhere here. So any node that lies above this level, that is will be considered in the level 1. In the level 2 lymph nodes, they are from this level up to the cricoid cartilage level. So here will come the cricoid cartilage. So at that level, lymph nodes beneath the sternocleidomastoid, and they lie very close to the internal jugular vein. So this is level 3 lymph nodes. Level 4 lymph nodes, they lie again beneath the sternocleidomastoid, but below the level of the cricoid cartilage. So below this, that is considered as the level 4. Then the level 5 lymph nodes, they are situated in the posterior triangle that I told you, that lies between the trapezius and the sternocleidomastoid muscle. Again, this 4 is further divided into 2. A very important structure traverses through this, and that is the accessory nerve. So the lymph nodes which lie above and below, so they are the two groups of this posterior triangle lymph nodes. Then the level 6, they lie in relation with the larynx and trachea, pretracheal, prelaryngeal lymph nodes. They are also called Delphian lymph nodes, they lie there. And then the paratracheal lymph nodes. Okay, so all these lymph nodes, they will be considered in the level 6. And level 7th lymph nodes, they are in the superior mediastinum. So about this level you must know, because as the level of the lymph nodes advance, the disease advances, and the staging also it will advance. And they are very important. And in the examination of the neck, we will have the inspection of the neck, then the palpation, and then the auscultation. Auscultation is important if the node, if the swelling is in vascular, or if that swelling lies very close to the great vessels. Then auscultation is of importance. Otherwise, mainly it is the inspection and the palpation. So you should be able to describe, because most common complaint in the neck will be swelling. So that swelling you should be able to describe its extent, where it is. You will see the size of the swelling, shape of the swelling, consistency of the swelling, whether it is pulsatile or not, and level of the swelling, whether it is like deeper or superficial. Now if the swelling lies deeper to the So we will have the inspection and palpation. Actually, ideally, when we are palpating the lymph nodes, we should stand behind the patient, and then in a very systematic way, we can palpate all the lymph nodes. Some of the lymph nodes they were not included, but in the level, and these lymph nodes they are also important. This pre-auricular or parotid lymph nodes, infra-auricular, and post-auricular lymph nodes, or they are also called mastoid lymph nodes. They are not included in this level. And then the retropharyngeal lymph nodes, they are also not included. So these retropharyngeal lymph nodes, they are situated behind the pharynx. That's why they are called retropharyngeal, and they are lateral and medial. The lateralmost lymph nodes, post retropharyngeal, they are also called Rouvier's lymph nodes. So that in that you should remember that some of the lymph nodes level they are not included in this level of the lymph nodes. Then the most common type of lesion or the complaint in the neck is the swelling. So you should be able to examine the swelling completely. So you should know its size. For that you'll have to measure it with the tape of measuring tape, and then you should be able to describe the extent. So when you are describing the extent, then you'll have to use this landmarks, whether it is approaching the chin, or it is approaching the angle of the mandible, or it is approaching the sternocleidomastoid, whether it is including the midline. Because the midline swellings, they are more common swellings are the thyroglossal cyst and suboid bursitis, and the low down the thyroid, even thyroid swelling also, they will be coming in the midline. And all these swellings they move with the deglutition. Now you can see this thyroid cartilage, and I will ask the patient to swallow the saliva, and then you can see the movement. Tu kar jao? Yes, you can see the movement, entire movement. So all the swellings which are attached with this your thyroid cartilage or the thyroid gland or the thyroid, this your trachea and the larynx, all these swellings they move with the deglutition. There is one swelling, that is thyroglossal cyst. That swelling even move when we ask the patient to protrude out the tongue. So here there is no growth you can see, but you can see some movement of the hard bone when you allow the patient to protrude out the tongue. Yes, protrude out your tongue. So you can see some movement here. Okay, so this is the most common site of the thyroglossal cyst, and that cyst will move if we ask the patient to protrude out the tongue. Then certain lymph nodes, this deep cervical group of lymph nodes, they lie deeper to the sternocleidomastoid. So for their palpation, you ask the patient to flex the neck so that these muscles they will get loose, and then you will feel like this. This upper deep cervical, middle deep cervical, lower deep cervical lymph nodes, for them you'll have to feel like this, because you'll have to go beneath the sternocleidomastoid. Then you can feel. If they're very big, then you can see also, and then on inspection also you can see. But otherwise, little lymphadenopathy is small. For that, you'll have to feel like this. And when we are feeling the lymph nodes, we should ask the patient to flex the neck. So after flexing, again you can see this submandibular lymph nodes you can feel, submental lymph nodes you can feel. And then this suprasternal space of this buns, that also you can see there is no fullness here. And here we can feel the trachea. So any shifting of the trachea that can be palpated, that can be seen and felt here. We should be able to appreciate the post-laryngeal crepitus. So for that, again we ask the patient to flex the neck, and then with the left hand you can hold this area and move it side by side. So I can feel the crepitus. So normally this crepitus must be felt, but if this crepitus is absent, that means there is some disease between the most common disease is the carcinoma of the postcricoid region. So carcinoma of the postcricoid region of the laryngopharynx. So in that case, this crepitus will not be appreciated. And if there is retropharyngeal abscess, even in those cases also, this crepitus will not be nicely appreciated. And this sign is called this Boca sign, and some of them they call this Toder sign, or this is the postlaryngeal crepitus. Then, if the swelling is there, as I was telling you, you should mention the size of the swelling, shape of the swelling, the margins of the swelling, the surface of the swelling, any congestion of vessels over that swelling, because in cases of lymphosarcoma, you can see engorged veins over the swelling. And in the posterior triangle region, the most common swellings they are arising from the lymph nodes, and they can be secondaries from the nasopharynx, oropharynx, and the oropharynx, and nasopharyngeal carcinoma. The lymphatic metastasis is common in the this your posterior triangle. Then in children you can see the cystic hygroma. So this is the common site for the cystic hygroma in children. Then on the anterior margin of the sternocleidomastoid, you can see sometimes swelling again that is common in grown-up children, and that is the branchial cyst. So this is the common site for the branchial cyst. So just at the anterior margin of the, you can see some of the part of the swelling that lies beneath the sternocleidomastoid, and other that lies anterior. So you can see the site here. Then there is one congenital condition, there is the branchial fistula. So that again you can see it's very pinpoint sort of opening that you can see again on the near the anterior margin of the sternocleidomastoid. So these are some of the common. Then this is the area for the thyroid swelling. So that will move along with the deglutition. Wish to know where the swelling lies, whether it is deep to the sternocleidomastoid or superficial to the sternocleidomastoid. We ask the patient to rotate the neck on the opposite side, this side. So that will make this muscle prominent. So if the swelling is lying beneath the sternocleidomastoid, it will become little less conspicuous, and if it is superficial to the sternocleidomastoid, that will become very conspicuous, means swelling will get enlarged. So that will tell us whether the swelling lies superficial to the sternocleidomastoid or deeper to the sternocleidomastoid. And this is the way we can make this muscle prominent. You can see it become prominent. So this is completely showing you the sternocleidomastoid muscle. Cervical lymph nodes, ideally a examiner should stand behind and his fingers should be adducted and little flexed. And we ask the patient to little flex the neck. So that will loosen the muscles, and you can see my thumb that can feel the preauricular lymph nodes, and these fingers they can feel the submandibular lymph nodes, and then we can retract the sternocleidomastoid muscle on both the sides and try to feel the deep group of cervical lymph nodes, and the thumb will feel the posterior triangle lymph nodes. Gradually then we can come anteriorly also. Anteriorly we can see the pretracheal, prelaryngeal lymph nodes and the paratracheal and paralaryngeal lymph nodes. So in this way also we can palpate, but mostly usually there is no space behind the patient, so we palpate usually the lymph nodes when we are sitting in front of the patient. The most common swellings in the neck, particularly in elderly patients, they are carcinomas. And the carcinoma of the oral cavity and oropharynx is very common. So sometimes patient will come only with a complaint of neck nodes. So this examination of the neck, in the examination of the neck we must examine even the oral cavity, pharynx and larynx. Because the carcinoma of these areas, they are very common and they can lead to cervical lymphatic metastasis in the neck. So neck, oral cavity, oropharynx, nasopharynx, laryngopharynx, that must be examined very properly. The tumors, we must auscultate that swelling, and the most common tumors, they are the carotid body tumors. So these carotid body tumors, they are situated in the carotid triangle, that is most common site. So there we must auscultate to listen for any brew, and if it is the thyroid swelling, again we should listen for any brew.